Hi everyone, welcome to Healthy Kids Corner with me, Dr. Brooks. This week I just want to chat, I think, a little bit about integrative care and how important that is for getting your child well. Many parents come to us where they've already been to 5, 6, 7, 8 doctors and they're a little lost. They're not sure what to do, who to trust, where to go, who to listen to, what website to read, what blog to listen to. So I have some general things to share with you that I think you might find very, very helpful. Part of our medical model is made up of lots of specialists. And I think allopathic medicine has done a wonderful job at making it so if you have a kidney infection or a kidney issue, you go to a nephrologist. If arthritis, you go see the rheumatologist. So there's all these wonderful specialists to help you with that one problem that you have, the chronic issue that bugs you. So what happens if you have lots of issues? I have parents that have therapists, speech, occupational, ABA, a neurologist, a pediatrician, a developmental pediatrician, a GI specialist, behavioral counseling, all these things. Now, are those bad things? No, absolutely not. The point is, though, who's going to bring that whole thing together to advocate for the child? And that's really what drove me to get into practice years ago and really specialize in these children with challenges. Part of the challenge is the families don't know who to trust or where to go. So, what do? I think it's really important to get everyone on the same page. I always tell parents, the way that your child gets well is finding a team of people that are willing to work for the best interests of the child. That's to say that sometimes you run across a doctor or a therapist or a clinician who says, hey, it's my way or the highway. You got to do it this way or you can't come here anymore. And that's fine. That might be their experience. I have found it, though, more helpful to have an integrative approach. That means I can't do everything. I love therapy. I refer out for occupational, speech, behavioral, social skills classes, all kinds of amazing things all the time because I don't do that. But what I do for myself and what I think you should ask your practitioner to do is get a treatment plan, right? I give every parent a treatment plan. This is what I'm doing, and this is what we're doing with your child and with your family. So you can share that with your teachers, with your therapists, with your family, with your doctors, so that we can get on the same page. There's contact information there for me, so they can call our office and ask us any questions. They can get medical records from us if they need to. That way we keep everyone talking. That is what gets a child better. There's too many chiefs and not enough Indians sometimes. So if everyone just kind of was a team player, you would get better results with your child. It's not always fun for the parent, and it surely is not always fun for the clinician. Let me tell you, it is not always fun for me to have to pick up the phone or write letters or do things, but for myself, I can say that there is nothing I won't do for the betterment of a child's health. Sometimes that means I get amazing new relationships with colleagues that I could have never received otherwise. So there's been some beautiful blessings in doing integrative care over the years. So that is my advice to you. I always tell parents a little bit of a step-by-step. Sometimes mom thinks we have an issue, dad says we don't have an issue. I see that a lot. I don't want to make that generality to all of you watching, but I think for the majority, that's kind of the case. So what I would say is sit down and individually, the two of you, and if you have grandparents or nannies or whoever is watching your children or is a part of the care of your child, have them sit down, have everyone over for dinner, and sit down and write down the challenges that you see with your child or that they see with your child. Everyone's interpretation is different. It's their subjective opinion. Does it mean it's any less than yours? Absolutely not. So get that down on paper. Then figure out what your goals are. Are my goals to be able to take my child to the grocery store without them having a sensory overload moment where you're kicking and screaming leaving the store? Is it to actually go to a birthday party and have them socializing with other children? Is it to take them on an airplane because they're terrified? Whatever those things are, make those goals for your child. Then from there, you can figure out what type of person, practitioner, can guide us to that the most efficient way within the things that we agree on. Not every family has the same philosophy. Some are open to medicating while others are not. And there is not a right or wrong way to go about it. It's just what is right for you. And then you can seek out the care practitioner that is best for you. I think for us, we have a long list of people that we use, that we've worked with through the years, that can help our parents. We know they work well with us, and then if we call them, they will talk to us. They will tell me what's going on with our patient. And we, of course, will always do the same. So this isn't, I'm making it sound easy, I know, and I know it's not. I know, after 8 years in practice, I have seen the tears, I have cried myself. It's very frustrating, but I would say if you go about it strategically, instead of your child has a delay, so you're going to go out and just do whatever, go about it a little more systematically, and you may find a better fit for yourself. And every family is different, right? We do the best that we can, and we try to bring in the families that are going to benefit the most from our services. If for whatever reason it doesn't work out, when they call, we say, you know what, we think maybe you should call this person, and we'll refer you to that person. I feel that is our job. Our job is to be a resource to the community, whether we are your direct link or we give you the name of somebody who is. I think it's all about healing for children. It's all about helping families get on that right track. I hope those steps help for you. If you would like to seek out some more education for yourself as a parent or as a clinician, you can visit our clinician courses at www.dramberbrooks.com. You can also find more information on my practice as well as blogs at mychildwellness.com. And of course on Facebook, you can find us at Whole Child Wellness, and on Twitter at WholeChild4U. Have a wonderful, wonderful week. I wish you the best on your road to wellness. See you next week. Bye.